The mission of CHI St. Vincent is to extend the healing ministry of Jesus Christ and to create healthier communities. That mission came from the Sisters of Charity of Nazareth and the Sisters of Mercy nearly 130 years ago, who answered a call to meet the needs of the communities that they served in their time. Our co-workers also have a strong sense of calling. Here's just one example of how they minister to the individual needs of our patients.
So my father was diagnosed with esophageal cancer at the beginning of February. It was amazing the quick turnaround. He was diagnosed on a Tuesday. He met with the surgeon on Wednesday and he had surgery Thursday. When he was readmitted to the hospital, and we learned just how aggressive his cancer was, and we learned his prognosis, I talked with Brian and I said, you know what, he doesn't have much longer to live, and I want to make his dream of walking me down the aisle come true.
Almost lost it the second I saw her and her dad come around the corner.
Walking down the aisle with my dad was truly, it was a dream come true. We bought a t-shirt, a tuxedo t-shirt for him to wear, and he stood up from his wheelchair to give me away, which was very emotional, but he was so proud, just the sense of pride and happiness. And I think the fact that St. Vincent assisted with us performing the wedding and pulling it off truly means that they care not only about the patients, but the patient's family as well.
Hello, I'm Polly Davenport, Chief Operating Officer for CHI St. Vincent. I'm very excited to tell you about a new vision for our ministry that will allow us to expand our Heart Institute and the Arkansas Neuroscience Institute. Specifically, we plan to renovate our North Hospital and relocate the Arkansas Neuroscience Institute, or ANI, to that campus. This move will create a destination center for neurosciences unlike any in our region. Under the direction of world-renowned surgeon Dr. Ali Krisht, the Arkansas Neuroscience Institute performs more than 1,000 intricate surgeries each year. We have greatly exceeded our capacity for this program, currently located at the infirmary. Today, more than 200 patients are awaiting surgery. Patients from 35 states and all 75 counties in Arkansas seek the care of our ANI team. And the need for these very specialized services continues to grow.
Our initial impact and goal is to take care of the patients in our community. But at the same time, our reach is beyond that. It's more national and international. This is why we have opened our program to receive patients from around the nation, and we do a good number of our patients, because of the unique aspect of what we do here and the fact that there are a lot of what's considered inoperable tumors that we are able to manage and give these patients some help beyond what's available in other places.
Our story started with a typical Saturday. She went back to the bedroom to work out. About 45 minutes later, I went back to take a shower, and when I got out of the shower, realized that something was wrong. Went to find her and realized she was face down on the floor in the bathroom and had a seizure and was unresponsive. Didn't know what had happened at that point in time, but knew that it was serious. You take somebody that basically, for all practical purposes, should not have made it, to somebody who now is walking, talking, driving. Dr.
Chris personally has been an amazing man to me through all of this difficult time I've been through, and he's done miracles. He really has.
A lot of the cases we do are very long, exhausting, but you have to keep going. And through education and research, this is what keeps you with the promise that hopefully you'll learn something new and do something better. Neurosurgery is a field which is very unknown. There's a lot of things we don't know about. We would like to become an oasis for all these thinkers and people around the world who deal with neurosurgical problems to come visit with us and to be able to learn from us at the same time to contribute to our learning. And this will be the place where anyone in the state can call, refer, and transport patients so that you can achieve great outcomes for our patients. It will really elevate the level of care to our patients to a standard that can become the model that everybody in the world wants to come and see. And that's what we're hoping to achieve.
With the A&I move to North, we will expand our newly established heart failure program at the infirmary campus. A new generation of leaders, Dr. Thurston Bauer and Dr. Mohammed Wakas, were recruited to Little Rock specifically to direct this innovative program.
Heart disease is the largest single killer in Arkansas, and we have one of the highest heart failure death rates in America. More than half of the patients diagnosed with heart failure die within 5 years of diagnosis. The establishment of our heart failure program, led by me and Dr. Thurston Bauer, will offer patients with severe heart failure treatment options that can improve their quality of life and offer them hope for a longer and better life.
People just feel so bad in the end stages of heart failure, and their quality of life really decreases. And so my goal is to make sure that people enjoy the time that they have and can feel good. And the heart failure program really aims to not only help people live longer, but for that time that they're living, live better and be able to go home and spend time with their family and get back to doing the hobbies that they were doing before they got sick.
In 2014, we significantly grew our Arkansas ministry with the addition of Hot Springs. Our Hot Springs campus serves the southwest corridor of the state and enables families one-stop medical care for acute, outpatient, physician clinics, and preventative health needs. Our existing mother-baby unit was created in 1991 and was built to accommodate 500 births per year. Our community has grown, and today we support close to 1,000 births per year. Not only have we outgrown our space, but the preferred model of care has also changed. The current design doesn't support the modern approach to the birthing experience. It is time to remodel our physical environment to better accommodate the health and emotional needs of expectant mothers and their family members who play a critical role in the birth of a child.
The overarching goal is obviously to have a healthy patient outcome, but we do recognize that it is a human process. And what this new facility will allow us to do is by integrating and overlapping the care that we see not just with doctors and nurses, but also with all the educational parts such as breastfeeding education, we're able to do that in a much more efficient and successful fashion.
The delivery of healthcare in the U.S. has and will continue to change, and there are many unknowns. What we do know is that CHI St. Vincent will continue to grow our network of care providers, hospitals, and clinics to care for all Arkansans, including the poor and vulnerable. I also know that the healthcare reimbursement model does not support funding advancements in healthcare. Transformative innovation, technology, and even renovations and facility upgrades are only achievable when we partner our resources with impactful and generous philanthropic investments. I am grateful for the many compassionate physicians and caregivers who serve our ministry. Today, it is in our hands to continue our legacy of caring, meet the changing needs of this community, improve access to care, and to create a healthier Arkansas. Our commitment is to make CHI St. Vincent a great place to work, practice medicine, and deliver excellent and compassionate care for generations.